Wan Dai Tang, commonly translated as end discharge decoction, is a classical traditional Chinese medicine formula in the category tonify spleen and stop discharge. Its core action is to strengthen the spleen, raises clear chi, and stops chronic vaginal discharge. The pattern framework is spleen deficiency with dampness and liver constraint. This mini-lecture focuses on the formula logic, recognizable pattern features, and practical drug-herb interaction screening. It is an educational overview, not an instruction to self-prescribe. Start with the pattern rather than the disease label. The traditional target pattern is spleen deficiency with dampness and liver constraint. Typical clues include profuse white discharge, fatigue, poor appetite, loose stool, pale tongue, weak pulse. These findings are not all required, and the same biomedical diagnosis can present with different Chinese medicine patterns. Conversely, these traditional signs can arise from multiple biomedical conditions. That is why pattern differentiation and conventional red flag screening should occur together. Key herbs commonly associated with this formula include Baizhu, Shanyao, Renshen, Baishao, Kangzhu, Gankao, Qianpai, Jingjai Sui, Chaihu, Chikai and Zai. In classical formula analysis, some herbs address the principal mechanism, others support the chief action, and others harmonize or direct the prescription. The exact composition can vary by lineage, manufacturer, granule concentration, and modification. For interaction analysis, the actual ingredient label and dose are more important than relying only on the traditional formula name. The first interaction focuses Gankao and electrolyte-sensitive drugs. Licorice-containing formulas deserve attention during sustained or high-dose use. Glycyrrhizin can produce a mineralocorticoid-like effect in susceptible people, with sodium retention, blood pressure elevation, and potassium loss. That can matter with loop or thiazide diuretics, digoxin, corticosteroids, antiarrhythmics, and existing hypertension. The risk is dose, duration, and patient dependent. In practice, ask what prescription drugs, over-the-counter products, supplements, alcohol, caffeine, and other herbal formulas the person uses. A multi-herb product can create several overlapping mechanisms at once, so medication reconciliation is a core safety step. The second interaction focuses Renshen with glucose and anticoagulation therapy. Ginseng may alter glucose control and has reported interactions with warfarin and other medicines, although results are not uniform across preparations. In a patient using insulin or glucose-lowering drugs, watch for an excessive fall in glucose. With warfarin, keep INR monitoring consistent and avoid abrupt changes in herbal product or dose without coordination. The quality of evidence for herb-drug interactions ranges from pharmacology and case reports to controlled human data, and that evidence is uneven. Therefore, distinguish a proven contraindication from a plausible additive effect, and use monitoring where the uncertainty is clinically meaningful. Safety summary. Use the formula only after pattern differentiation and medication review. Persistent, severe, or unexplained symptoms require appropriate biomedical assessment. Also verify species identity, processing method, contamination testing, and manufacturer quality. Stop and seek appropriate care for severe or rapidly worsening symptoms, allergic reactions, fainting, chest pain, major bleeding, neurologic deficits, or other red flags. Pregnancy, breastfeeding, significant kidney or liver disease, and polypharmacy warrant a lower threshold for professional review. A useful clinical checklist has 5 steps. 1. Confirm the traditional pattern. 2. Identify the exact product and full ingredient list. 3. Reconcile prescriptions, over-the-counter drugs, supplements, and other herbs. 4. Identify measurable endpoints, such as blood pressure, glucose, inner, electrolytes, symptoms, or bowel function when relevant. 5. Reassess after starting, stopping, or changing the formula rather than assuming the response will be stable. In summary, Wan Dai Tang is best understood as a pattern-based prescription whose action is to strengthen the spleen, raises clear chi, and stops chronic vaginal discharge. The key safety principle is targeted interaction screening plus objective monitoring when risk is plausible. Standard references for further study include Chinese herbal medicine formulas and strategies by Bensky and colleagues, Chinese medical herbology and pharmacology by Chen and Chen, and current drug interaction and pharmacology references.